As part of the MPH program at St. Ambrose University, we're required to complete our own applied practice experience and integrated learning experience, which equate to a field practicum for developing public health experience and a high-level written output equivalent to a thesis. My name is Freedom Martin, and for my APE and ILE, I worked on a community-level education-based flu intervention called MyAF. For my applied practice experience, I collaborated with a free clinic in Winona, Minnesota by the name of Bridges Health to design and implement a community-level flu intervention with a focus on reducing flu transmission through primarily education. Our flu campaign, which we named Me and You Against the Flu, or MyAF for short, put less effort into improving the availability of physical resources and more effort into increasing the availability of information pertaining to the flu. Efforts to this end included the creation of flyers that both promoted the campaign and listed local vaccination sites, infographics that convey basic info about preventing the spread of flu, and a series of webinar recordings on a variety of flu-related topics. The webinar topics range from vaccine education to social determinants of health as they relate to the flu, to suggestions for fun flu-safe activities such as picking up a new instrument or language. MyAF promoted community engagement, drawing from the integrative theory of behavior change in the belief that normalizing flu-safe behaviors would make it easier for people to feel comfortable with them. For my ILE, I think I was initially considering writing a policy brief related to tobacco use among Minnesota's Native American population, but after consulting with Dr. Doak, we were able to find a way to connect the ILE to the APE, eventually culminating in a comprehensive program plan for any organization that would be interested in conducting a MyAF campaign of their own. To help an organization hit the ground running should they be interested in conducting a MyAF campaign, I combined two project frameworks that would together reflect the intended nature of this intervention, namely to be a sustainable, iterative campaign that starts and ends with the flu season. The MAP IT framework, which is provided by Healthy People 2020, lays out a solid structure for how to design a program in 5 phases. The PDCA cycle, discussed by Garemflo and Moran, is a quality improvement cycle that can help public health workers identify methods of changing a process so that it performs more effectively. By combining the two, we got MAPICA, a program plan framework that encourages iterative improvement to a given program over time. Another nifty part of the program plan is a section devoted to helping an organization decide whether MyAF is the right tool for the issue they face. For example, MyAF would have little effect if a community faced issues regarding vaccine availability, but would function much more effectively if the community was being swept by misinformation or simply wasn't aware of where to get vaccinated. MyAF was substantial in my development as a public health worker. Working on this program highlighted things like the oxymoronic need for a detailed structure to follow, but also to be readily adaptable on the fly. The difficulties that can come not just from engaging with stakeholders, but the actual difficulty of even getting into contact with them, and the importance of timeframes. It also highlighted many positives, such as the strength of interprofessional activity, the passion that public health workers all seem to share, and the good that can be done by focusing not just on individuals, but on entire communities and populations. Even after all of that, and even after years of public health education, I feel as though I'm just at the tip of the iceberg in terms of the full public health experience. It seems like employers agree, because they always seem to be asking for experience and education rather than experience through education. Even so, I'm happy to say that on Tuesday I accepted a job offer from the Red Cross to work as a donor center coordinator. I'm excited to see what doors this new experience will open up in the future. Thanks for listening.